Okay, we'll go ahead and call the meeting to order, Jackson County Board of Commissioners. Today is our work session, June 13th, 2021. I want to welcome everyone. It's nice to start seeing faces once again. Come to our meetings. And the first item of business will be hearing from our planning director, Mr. Poston, but I'll recognize our county manager to tee up any comments prior to the start of the meeting, and we'll go from there.
No, sir. I believe the agenda is self-explanatory, so first up is Mr. Poston.
Okay.
Short step from him.
I defer my time to Mr. Poston.
I'll need every second of it.
Yeah.
I will start the timer.
Thankfully, Christy Carter's here with Traffic Planning and Design, who were the consultants that helped us with the pedestrian plan. She will actually be doing most of the talking, so you'll have to survive. You'll survive that much better, I'm sure. Wanted just to set the table real quick and remind you what we're doing with the transportation plan or to the pedestrian plan. A few years back, we came to the Board of Commissioners and asked to apply for a grant from DOT to allow the county to enter into a 70-30 cost share to do a pedestrian plan, to plan for how we're going to move people throughout the county that are using mainly pedestrian means. And we got that grant awarded to us. DOT is the one that manages those grant funds and the process. And we were very fortunate that they assigned TPD and Christy Carter and her team to help us out. Christy has a lot of familiarity with Jackson County, not just in the county doing work with the county, but also through several municipalities. So it gave us a big leg up on coming in and understanding the needs of Jackson County. I think right now we're the second county. I think there's actually two counties in our funding cycle that got the PED plan. There's only one additional county that's completed a pedestrian plan in the state of North Carolina. So this is something very new for counties to do, but certainly for a county like Jackson County, very important. So certainly I'll now turn it over to Christy and let her kind of walk you through the planning process, where we started, and how the steering committee that we assembled created some goals and objectives for the board's consideration.
Welcome.
Thank you. One of my favorite pastimes is harassing Mike. So to be in a room full of people who also harass Mike, I feel like I'm among my family.
Doesn't that just make you feel like?
Yes, it feels very good. So as Mike said, I'm Christy Carter. I live in Asheville, work for traffic planning and design, and have done a lot of work with Jackson County over the years. Western grad in Jackson County is one of my favorite counties in Western North Carolina, if not my favorite county. So I will go through the presentation. I'm going to go through just kind of a lot of information and try to do that pretty quickly to leave some room for dialogue at the end. And I will say, I'm not going to go through each of the specific projects, but if you have questions, I have those ready to be queued up. So just quickly, the plan purpose. When we started this, Mike kind of set the stage, but when we got into it, is there a way to move the, okay, thanks. Thanks. So we wanted to know, where do people, when we started with our community engagement structure, our steering committee structure, by kind of asking the question, where do people want to go? How do we connect those? So if you want to go from one park to downtown Silva, how do you get there on foot? That's the second question. Then the third question is, if people want to go from point A to point B, how do you actually build that network? And that's the big question for the county. And then how do we build a pedestrian-friendly Jackson County and kind of work pedestrian friendliness into the county as a whole, beyond specific projects like when you're thinking about master planning or small area plans, which you all have done a good job with, thinking about how to make those areas more pedestrian friendly. Working with the steering committee, we identified a set of goals that throughout the process we kind of benchmark everything against these goals, and improving safety for all. For a rural county, you have you've had a number of pedestrian fatalities on your roadway network. That's concerning. You do have a higher than average number of crashes for a county your size. We want to promote inclusiveness and equity, so making sure that people who have to walk for transportation, maybe can't drive a car or don't have a car, have access to pedestrian facilities. We wanted to create a prioritized list of projects, and thinking about making some of the connections between the physical activity and your public health goals in the pedestrian plan, and then really prioritizing the connections to schools in Southwestern Community College and Western Carolina. So those were the goals. Everything was benchmarked against throughout the process. Just very quickly, why this plan to create a vision for pedestrian connectivity, position the county for future funding. I'm going to talk a lot about that in a moment. And then supporting the local multimodal goals. We did a plan review, went through all of Jackson County's plans, and you all had a lot of plans. And all of those plans, particularly the ones that are newer, like the Casher Small Area Plan, the Cullowhee Small Area Plan, all emphasize the need for multimodal connectivity, particularly pedestrian facilities. So we wanted to integrate that in this one plan. So when I mentioned I'm going to talk a good bit about the funding piece, I think as commissioners, this is something I feel like is really important for you all. If you were to add up, which I'm not going to do, the cost of all the projects that we have listed in here, it's a shocking number. It's a lot. The projects are really expensive. But the good news is the NCDOT, it's been over a year now, they have adopted a new updated complete streets policy, where in the past, it was if a community had a line on a map and said, we want a bike lane, or we want a greenway, or we want a sidewalk along this road, DOT would say, great, it's going to cost you. Now the complete streets policy, if that line is in a map and it's in conjunction with the DOT project, then DOT has 100% of the cost share on that. So 107, if we had been thinking about the NC 107 project today, it'd be a much different story on the cost sharing and how those pedestrian facilities would go in along NC 107. So even though the price tag is big, without this plan, you wouldn't be able to participate in this cost share with NCDOT as clearly. So that this is this plan is developed in partnership with the NCDOT Mobility Division. We have the lines on the map. The complete streets policy is in place, and that puts the county in good position for. It puts you in a position of readiness when projects come through as years go by. One thing I'll say, because I think this is important for context, is Mike mentioned planning on a county in North Carolina. Planning on a county scale is a little unusual because counties aren't in the roadway business, and so you kind of have to figure out how do we provide this transportation facility when we don't have a transportation department who's out building roads, maintaining sidewalks. So it's a little unusual. Jackson County, no surprise, is a little unusual for a county also, because you have the planning areas, you've done a lot of work, you have these urban areas with no municipality that are acting like towns and need to have kind of town features like sidewalks and things, but you're doing it through that county structure. So we had to kind of dig in and figure out how that might work, and I'll talk about that in a bit. Just quickly, how we got from the beginning to the end. We had, particularly in terms of how we work with the community, we started out with a steering committee. We did work with them to kind of identify those initial goals. We put out a survey to kind of talk to people about what they wanted to see and where they wanted to go. We had public meetings. No surprise, we had to adjust this Jackson County was definitely a learning experience for us for COVID, because we started out all in person plan. Clearly that didn't happen. So we had to kind of pivot on some things. So from that first stage, then we developed a list of potential projects. Then we came out, and I'm going to go through some more numbers on that. Field work, adding kind of local knowledge and context. We came up with an initial project list, brought that back out to the community through another survey instead of public meetings, and then kind of came up with a final project list that you see in the plan. And all throughout that, the steering committee was giving us feedback. So just I know as commissioners, it's helpful to understand what did the community say, how did we involve them, so that if you are standing out saying, yep, this is what we want to do, you know that you have some community backing. As I mentioned, most of our activities were virtual, 2 project surveys, 5 steering committee meetings, 12 focus group meetings, 2 public meetings, which we say 2 public meetings, but we had multiple sessions of those. So I think we had 4 total. And then engagement in working with the County Greenway Committee. So survey number 1, we had a great response to that. Over 1,000 people participated, 2,300 different types of data points from that, and then 810 comments. So it was an online mapping. Those 2,300 just on the online mapping and the individual comments combined. So really good participation we felt with that one. Some of the things that we heard probably are not surprising to you. People want to walk for recreation. They would use greenways more often if they're more connected. That if it was more convenient, felt safer, they would like to walk for recreation and socialization. And 10% of the folks who took the survey said they had some type of physical limitation that made walking difficult. And that's really important in thinking about sidewalks and ADA accessibility. And I'm going to hit that kind of toward the end and why it's really important for you all to think about that.
How representative of the general population would this be? This is for Jackson County, obviously.
Yeah,
So we say 10% have physical
physical
limitations.
disabilities.
Is that higher, lower? Do you have any sense to know where that's?
I might be able to tell you that.
That's a good question.
That is a good question that I'm not sure I'll be able to pull up super easy, but I can get that information to you. I'm not sure. Let me
Okay,
look it
that's
up. Yeah.
I just wanted to make one comment about that. I walk the Greenway quite a bit, and I see people there with walkers, you know, not too many,
Yeah.
but I know that there are people that have had some health events that require them to get up and walk. And the Greenway is great because it's paved. They can go with the walker
And flat.
and flat.
Yeah.
Absolutely.
Yeah.
So, I mean, I think that even though that may seem like a barrier, there are people that use it because of that.
Yeah, yes, and we just asked the question because we think it's helpful to know because of those
Yes.
things you're naming.
Yeah.
Like if you're looking for funding sources, maybe looking to public health funding partners.
Okay.
Because we were going on a little bit of an aside, we just finished up a really small pedestrian plan similar to yours in Lansing, North Carolina, which is in Ashe County. They're like population 130 people. And lots of, most of the folks who live there are older, and their greenway is like they have some doctor that prescribes them to walk the greenway.
Yeah.
So it is important.
It's a huge help.
I'm gonna just skip this just to say that here are some of the highlights from the survey one. Nothing too surprising. People kind of, as we do these plans, the easy way to summarize it is people always want more and better. More greenways, better greenways through lighting, maybe some flatter trails, better parking, things like that. So we've certainly heard that. We didn't hear as much about sidewalks because there aren't as many sidewalks. We did hear some, I don't want to minimize that we didn't hear anything, but people really gave us a lot of feedback on the Greenway network. Our focus group conversations, NAACP here, Jackson County Transit, WCU, Town of Silva, DOT, Department of Aging, Community Table, and some others. We haven't given you the appendix yet, but we'll have a list of everybody in the appendix that participated. Got really good kind of specific feedback from those focus groups. And I think that helped balance not being able to meet with people in person through COVID. So survey number 2 was ranking projects. So we had 429 rankings of the people who ranked those projects. The recommended segments are nice, but crossings are important. So one thing that I think maybe if we had a time machine and started this process over, we didn't minimize crossings, but it's harder for the general public to weigh in on crossings because they are really, really technical in terms of how they work. So we probably would have communicated that a little better on the front end. People want connections and access, particularly to schools and the recreation sites. And this is probably your everyday life. You get all perspectives of no one walks here, or this is critical for all walkers going to the store. So we got all sides of it. As commissioners, I'm sure you live and eat that every day. So let me jump into project development. The planning considerations that we factored in, we looked at each of the kind of more developed areas. We didn't think that once we kind of got into it, you have a lot of rural areas that are, so you have that it's just not feasible or probably not a cost benefit to do a sidewalk in all the way up 107. Like it's just not gonna work. So we looked at what are the developed areas and how do you make those as connected as possible. In really long range, you can start thinking about how to connect Cullowhee to Cashers, but that's a really long range that we didn't even really put in here because that would be an undertaking. We did capture all ideas, but not every idea got prioritized, and crossings are prioritized within the segment. So that's another thing, as I mentioned, with the crossing conversation that we probably should have had a little differently. So one thing about Jackson County, to start with, there were no shortage of plans and ideas to work with even before we went to the community. So that was kind of our first thing. We looked at the plans and projects that you had out through your CTP, the small area plans, and then we went to the community and said, what do you think? We came up with 140 planned projects, 53 lines from the community, and 457 location-specific comments from the community. So we were like, whoa, we can't, that's crazy. So we refined us down to 120, and then we came out and did field work over a few days and narrowed that down a little further, and then we came up with some projects while we were out in the field doing field work. So by the end, we had kind of this group of 67 projects to work with, and we were only budgeted to do 10 cut sheets. So when you look in the document and you see these cut sheets that are numbered, those were like the top of the top. So 10 of those got flushed out that way. And of those 67 projects, we prioritized them based on safety, connectivity, feasibility, meaning can you actually build it, public feedback, and equity. The feasibility and the connectivity and the safety and somewhat the equity, we felt like it was important for Jackson County to prioritize the projects in here similar to how they're prioritized in the STIP process, because that's how you're going to get your projects. So for each of these projects, you kind of have that data when you're working with the RPO and rows and fleshing out activities. They're ranked in a similar way, not exact because it didn't quite translate, but as closely as we possibly could. And then kind of a prioritization step 2, we tried to spread them across the county so that every area had roughly 2 projects. We started with 1 sidewalk project and 1 non-sidewalk project. That held true except for Cashers, who really wanted 2 sidewalk projects, and we think that was probably the right decision. So total, 122 linear projects, 10 priority, 55 secondary, 57 additional, 34 crossing projects. It's a lot. And I don't want you to get overwhelmed by that because I'm going to talk about that in a second too. Here are the top 10. Those are the ones that, as I mentioned, you'll see the project sheets for. They're the ones that have we did a kind of detailed field view, did a detailed engineering estimate in terms of the cost. And I have we'll leave this, I think you'll have that PowerPoint presentation, you have them in here. So I'm not going to go through each of those, but if when we're talking, we want to go through anything specific, I'm ready to do that.
Turn it back one more time, please.
Yes.
Now, I don't see the sidewalk along, I call it Old Asheville Highway. What's that road?
Skylar
Chipper.
Drive.
Yeah.
Skyland Drive.
Okay, that's a good point. So
Yeah.
we did not, it
And
does
that-
say it in here,
That was
there
a
were a
priority.
handful of projects that already have, they already are a project in process,
Okay.
and that is
okay.
one of them. So
I
that-
thought
so-
maybe that was.
Yeah, that is a good distinction. Like NC 107, you won't see any projects here because it's like, there were so many projects and there's work being done on those. We're like, let's just let that happen.
That's-
Well, I was gonna ask you that at the end when you finished up. When we're looking at these projects that we wish and hope and have an aspiration to do. And here we've got a project out here where we got, I can take you out there right now, there's old people, young people, people carrying babies, pushing carts, everything else, walking that road every day. And it's been going on there since 1951, I guess.
Yeah, I mean that.
And here we talk about all these new things, and we've been 3 years, I guess, gonna get that done, and they have to walk through there and push the bushes back from their side, whatever.
Somewhere in here, we have a map of those
Yeah.
projects.
I was looking to the Buchanan Loop connector. Buchanan Loop, that's just residential traffic. That's not a high vehicle traffic area.
No, it's a high walking
It
area.
is a high
Yes,
walking
but it's
area.
Lots of
But it's
people.
low
Yeah,
vehicle
it
use.
is.
And the vehicle use is only for residents. It's not like it's somewhere where it's high traffic.
And with Buchanan Loop, we started out with a shared street concept and DOT said no. And so it's more just traffic calming because it is a popular walking
It
spot.
is.
And so it's like, if you could work with if Webster and NCDOT and if Jackson County is a partner in that could do a little bit of investment in traffic calming, it's kind of like getting a greenway recreation facility without having to build a greenway recreation facility. And I will tell, so gosh, probably 5 before Mike was here, or right as Mike was coming in, I did some work in Webster, and it was a preference then, it was a preference in your comprehensive transportation plan, it was preference in the comp plan. So that road in particular, it is kind of an odd one, but it has been, people walk there and the community has wanted something to be done for a long time.
One more thing on that Skyline Drive
Sure.
thing, that's not a fun walk. That's not, I'm gonna get exercise walk.
Right, it's a
Those people are
necessity.
walking that road every day to go to work.
Yep.
And go get groceries.
Get food.
And they don't have a car,
Yeah.
and we just completely continue our way to some
So-
car knocks.
Yeah, so from what I know, so DOT ran into a budget crunch, so Town of Silva, that project is already on the books. The Town of Silva is contributing to the project because this happened before the new police street project happened. They're just waiting for the funding to be released so they can go out and do that project. So that project is on the books and is coming. It's just, it's got caught up in when DOT kind of put the brakes on all of their projects because of the funding source. So we're just waiting in line to get that project moving forward. But that is something that the Town of Silva has already contributed to. It's already been prioritized. It's already been funded to the extent that it gets funded. So it's just waiting for that process.
Yeah, I realize,
And
we're just waiting.
Just to draw your attention to page 115, there's a table at the bottom of that lists all those projects that had some type of additional study done to them. And
So just so everybody knows, we didn't print copies, it's online right now. I wasn't sure how the
Okay.
presentation was gonna be, so anybody who wants a printed copy, we will provide you a printed copy, but we also have this accessible online.
On the planning website, we can send you those links as well.
Ms. Carter, on that Wendy's to Cashers Crossroads, Mike, isn't that private development that was just approved on to do part of that?
Part of it, right, so I think that, yeah, so, really what we're planning when we talk about the Wendy's to Cashers and then Cashers to Ingles, basically, Centertown to Ingles, is we put it in there because we realize there are potential for projects along those corridors like 64 and 107. And again, it really is any gaps that exist by the time they get there, DOT is going to pay for those gaps to be put in because they're going to be part of these planning documents. And so why we're showing a lot of projects, we don't know when DOT is going to have money to do a project sometimes. And so we want to be prepared to take advantage of that in the areas that we want to do. So that's the big reason why we are more inclusive. Now, Chrissy's right, we only had budgeting through because DOT, this is still a DOT planning process, so we still follow their rules. And so we kind of set it up in that fashion, and Christy works with DOT as much as us to make sure that this plan gets their approval as well. So we had to have a methodology, we had to develop some of these things. So some of the components of this plan are requirements of the grant that we are, so that's just why you're seeing some of these things pop up.
And I do want to hit one more point, and I realize I'm at time, but we do have a section in here for policy recommendations. Early on when I started talking to Mike about this, there is that odd fit of Jackson County wanting to be a sidewalk provider, for lack of a better term, but without the structure to do that. So Mike said, what are some of the considerations that we need to think about? So in the document, we went through your ordinance, your UDO, and pulled out some things that could be tightened up in there in terms of getting sidewalks through development. There's lots of inconsistency, and Mike, I think, knows that and kind of sees that as a future project. But also the thing we want to emphasize is that it's really important to have this conversation, the sidewalk acceptance conversation with NCDOT, because what we are just kind of, I'll point to Heather over here. If Heather is being in her role as your attorney, she should have some caution on taking sidewalks that are not ADA compliant. So therefore, you all need to make sure that before you accept sidewalks, that they are definitely built to NCDOT standards, and that DOT is doing a good job to make sure that those sidewalks are ADA compliant, so that you don't accept sidewalks that are not ADA compliant. And so we have some resources and some feedback for you in there. But I guess what I'm leaving you with is that there is a little bit more work for you all to do before you start wholesale taking on sidewalks. And we've given you kind of at least a foundation to start working both from a land use side and from a policy side. You know, we didn't hand you a completed policy because there needs to be more discussion with staff and planning board and everybody involved in that. So I didn't want to leave that out. It's kind of like burying the lead, because I think for you all in the position that you're in, this is probably one of the most important things. And hopefully we put you on a good foundation to do that. So, given time, I will just say you have our contact information. You can contact Mike if you have any other comments, and you guys can guide me. I can stand up here as long as you need, but I know you need to move through, so if you have other questions.
I think for what we'd ask the commissioners to take a look at would just be, we'll need to formally adopt this when the commission is favorable to considering that. That will help us close out the grant funding, and the grant cycle will be ending here in the next few months. So whenever the board feels like that's appropriate, we will certainly be able to do that. So if there's any comments or corrections or thoughts, we would love to hear those as well.
Commissioner Wood, you?
I do have a question. You referred to traffic calming a couple times, and I don't know what that is.
Thank
I
you.
don't either. So.
Traffic calming is if you have ever been speeding down a road and somebody puts a speed bump in the middle of the road and you're like, oh my gosh, where'd that come from? Why is that there?
Okay.
That is one form of traffic calming.
I see.
To make
calming.
Yeah.
Okay.
CALMI. I talk fast. I'm sorry.
No, it's fine. I thought it was COMB.
Yeah,
Calming.
traffic calming. So
Okay.
you probably have seen it many times, just didn't know.
Yes,
You can use
that makes sense.
bump outs and bulb outs.
Okay.
yeah.
Thanks.
So what I wanted to do is flip to this side here, because what we'll do is follow up when Mike was mentioning about eventually adopting this plan. So this is the plan without going through it, and at this point, what I told Mike, would create a link, and then let's see who wants hard copies, who wants to be able to go online, because you can go, is it on your webpage at this point? But I just wanted to show you, it is a 150-page document. After the meeting, just let us know.
Sorry.
Let us know if you want a hard copy, okay? And we'll be happy to print your hard copy and bring it to you. Or we can email it to you if you don't want to go online, things of that nature. But I just wanted to show you the context here. You got a very brief overview, and I do encourage everybody to go back, take this document, go through it, and basically just review the details of what's been presented to you today.
Absolutely.
And you'll also notice
Thank you
everybody
so
that was involved in the process. We have quite an extensive steering committee made up of just about everybody that, all the community partners that we could think of, the towns, the university, the community college, the Board of Education. We tried to bring in as many people as we could because, pedestrian safety touches a lot of different areas of our communities.
I know Commissioner Dietz mentioned a point that I thought was interesting, and I want to expand upon as well, about Skyline Drive and Chipper Curve and that area where we see a lot of people walk that road because they have to.
Yep.
Because it is their only way to get to point A to point B for shopping, whatever, work purposes, etc. And I think, and this may be me, and if it is, and please someone tell me that I'm different. Please do. But I feel like there is sometimes a stigma to the term sidewalk. And it conjures up the only reason people are on sidewalk is because they don't have a vehicle.
Yeah.
And it could be because of socioeconomical reasons. It could be for a lot of reasons. But when you think about Greenway, first thing I think about is a beautiful walking path where people are doing it for enjoyment and recreation, and are happy to be there. You don't think of somebody on a sidewalk being there for a happy, enjoyable reason. So I think there's got to be a way, if we're going to try to tie all these together, and really sidewalks are greenways. And it's a way to connect our communities. We've got to figure out a way to make it more acceptable and remove that stigma to where people don't see it as, oh, this is a sidewalk.
Yeah.
This is a greenway. This is a way to walk.
Yeah.
Am I off base on something?
No, you're not off
No,
base.
that's true.
I think that this is not what you're saying. This is how I'm going to interpret what you said. That we want people to be able to walk with dignity, and a lot of our sidewalks, not just here but everywhere, don't allow people to walk with
Exactly.
dignity. And you can build sidewalk where people can walk with dignity. You put a 5-foot buffer and you put a 5-foot, 6-foot sidewalk where you have that separation from traffic, where it's a lower cost facility than a greenway, but you can still feel safe, feel like you can walk with your kid without worrying about them jutting out into traffic. The Chipper Curve and Skyline Drive. I mean, I worked with Paige on some land use stuff in Silva. And one of the recommendations was that whole area actually needs a small area plan, and there are some big transportation concerns that I have along that corridor. The sidewalk that's going in there, which should have that buffer if it's to NCDOT standards.
That's
I don't know
gonna
if
be
you've
difficult.
seen the cross section.
And that's gonna be real difficult.
It's going to be
We'll
difficult.
fix that like it should be fixed.
Yeah.
But we had a kid killed up on that
Yep.
road.
Yeah.
I mean, that's not something just,
It is.
it's
Yeah,
serious.
Yeah.
And it,
Yeah, and I think Paige is really aware of that and wants to see something better there. We don't have, I guess we could go back and we'll go back and look and see if we can if we need to add anything, because we kind of didn't put that resource there because it was a project, but let us go back and do a little bit on that, and we can get back to you with that.
Well, it's interesting you mentioned that, because I'll walk on the sidewalk from the library to my home in
Yeah.
Mactown Gap. And I've had several people stop and say, Gail, are you okay? Do you need a ride? They assume
Yeah.
because I'm walking there that my car's broken down,
Right.
or maybe I don't have a car,
Right.
or whatever. And,
They don't ask you
we've
that on
had
the greenway, do they?
no, they don't. And maybe because I'm old, but people stop. I've had sheriff's department stop, and even our emergency services. Todd Dillard stopped one day and said, Miss Woody, are you okay? So it
Should be
is
like,
a
yeah, I'm having a
perception.
great time.
And I could ride in those vehicles. I mean, but they offered me rides.
Yeah.
But the perception is there, I think,
Yeah.
and I think the more we get these connected, the more people will take advantage of them.
Yeah.
And use them, and it will.
An example of that too, we had, public transportation,
Mhm.
public transit, and there was this perception that the only people on public transit are the old people or people that, so.
Yeah.
We did a lot of work to try to change the appearance,
Mm.
call it the Jackson Trolley.
Yeah.
And do some work to make it look more pleasing,
Right.
to
Right.
encourage people, this is something that you want to get on and use.
Right. And that's a good example. One of the things that I talked about in terms of one of the goals is making Jackson County a pedestrian friendly environment, where we're not talking about projects specific, like on the ground projects. It's kind of working that into the culture of what you're doing, that it's okay to walk. Like you're not having your car's not broken down if you're walking. It's a pleasant thing, so there is lots of information in here, but we hope we've made those connections to kind of go beyond just the lines on a map. And you all are well positioned to kind of do that stuff, which is pretty exciting. Again, I'm a little biased about Jackson County, but I think I'm feeling like I really need to stop because you have other things on your agenda, but I will get back to you about the disability question, and then we'll follow up on Skyland Drive and see if there's anything we need to add there.
Absolutely, thank you
All
very much.
thank you, man.
You doing well?
Can I make
I'm doing better.
Yeah, go ahead.
one more comment before you leave, and I think this helped me immensely because I'm a visual person. But Phil and I drove over to Rabun County to get some catfish. But anyway, we went through the Georgia Road,
Uh-huh.
and that is what 107 is going to look like. And to see it, I think I would encourage everyone to go there if you haven't been on that road lately. It's a mess. I mean, they're building it, but it's not as intrusive on the sides as I thought it would be. And the the islands in the middle, it's so that you can't turn left except at lights.
Yep.
The safety is really increased. It has a very small bike lane and then a space and then the sidewalk. And that division for that sidewalk is gonna make it so much more pleasant to walk. So I was very encouraged to actually see it and see how it's gonna end up.
Yep.
And I think our county will be very pleased
And you're,
when that's finished.
the trick is getting those crossings right, and that's
Yes.
where you need to just,
Yeah.
everybody in this community needs to be an advocate about
Yeah.
getting the crossings right. And I
Yes.
think DOT knows that, and so
Yeah.
that's a good thing, because those roads, even, because the width, you can do all kinds of stuff, but the width is still, as a pedestrian, the width is what the width is.
Yeah.
And it's a long distance to cross, and so it's really key that those are good crossings,
Thank you.
so, all right,
Thank you.
thanks.
You should go see that, drive that.
Got one?
Mr. Evans?
Georgia Road.
Yes, sir. And I just, as
It's
everybody
really
was
looking
talking,
good.
what I did have up on the screen for folks watching YouTube, I do encourage people, even though you see a 150-page document, just pay attention to the table of contents. And what I've been scrolling to is the top priorities that you've seen on the screen. And I just wanted to give some examples of what they have, where they specifically identify where the proposed sidewalk is, cost estimates, and then they give you some detail about the area itself. And then they go on and talk about some concepts of after images and crosswalks. So I encourage people to go back and look at this. It'll give you a lot more detail than just a list of priorities of what they're looking at. And then the second thing I'd like to mention is that what's being presented to you today is a plan. And with this plan, there's multiple ways to fund the plan. So it's not like these projects will come to you as a board, all of them to be funded. It'll be looked at partnerships between the county and say Webster and NCDOT. There'll be partnerships with new development. All of that will occur. So I just want to make sure everybody understands when you start looking at these estimated price tags that are on these elements, that's not necessarily just borne by Jackson County. It's going to be partnerships. And that's what she was really pointing out with NCDOT, where we would qualify for these cost shares and things of that nature. So I encourage everybody to go back and take a look and just go through and look at this plan.
Okay.
Okay. Next item is, we do have Ms. Foreman here from Via Health, and she has a lot of information to share with the board, updates.
Okay. Welcome, Shelley.
Hey, do you, are you going to pull up the PowerPoint?
Sure.
Now, this is
Do you
gonna be
want to control it and scroll, or do you want me to?
Pardon?
Oh, do you, actually, what we have for you is, we don't have the actual PowerPoint. What we have is, you need this to scroll.
Oh, okay, or I can do it from here.
Here, so just, all you gotta do is just when you go through, all you gotta do is just roll it. See, can you get that?
Oh, okay,
Yeah, just-
okay, so this is my challenge at my age, contacts for distance and reading glasses for close up. So are you seeing it on your screen?
Yes.
Oh, okay,
We
so
are.
I think I'll just do
And they
this.
have copies too.
Oh, okay.
Do you want me to control, or do you want me to? Or
I
do you want, you got it?
Why don't you? Okay, that way
Just
I
tell me
can.
when you wanna go next page.
Thank you. You'd think by now my technological skills would be even better, but it's like which way to look. And I think you moved the podium, which is like, okay, I'll look over here. Well, thank you for
Gail and I
having me.
can't see well, but finally got.
That's, I know, that, yeah. My name is Shelley Foreman. It's nice to meet some of you for the first time. I'm the Regional Community Relations Director with Via Health. And I always have to start a presentation by thanking Chairman McMahon for his work on our County Commissioner Advisory Board. He does a wonderful job. We've been meeting virtually, which makes it a little bit easier, I think, across 22 counties. So thank you for your
It's hard to have meals virtually.
I know, I miss that too. Yeah, I miss the meals. We always had pretty good meals too. Although you remember they got, I ordered eggplant parmesan once, or Tammy asked me what, and then after that we had eggplant parmesan every time. I said, you can change it up. That was just for me. But yeah, we'll have to try to figure that out. And so just as a reminder, and knowing that the public might be viewing this, Via Health is a public agency. We're a local subdivision of the state. And we serve 22 counties in Western North Carolina in the foothills area. And we currently manage Medicaid funds for people with mental health, substance use, and developmental disabilities. We also manage state funds, which are funds allocated by the General Assembly for people who have those 3 disability areas. So we have a variety of ways that we support people in the community with both Medicaid and state funds. So many of you will remember probably 4 or 5 years ago, we began talking about Medicaid transformation. And we began moving forward with the state on that issue. Plans were made, and then due to issues with the budget that was not passed, where we had a continuation budget several years ago in the pandemic, Medicaid transformation was put on hold. One of the things that you probably have heard from your DSS director, others who've come to you to talk about Medicaid transformation, is that process has now gone live. So it's hard for me to talk about where VIA fits in that without talking a little bit about what is transformation. So basically, transformation began with House Bill 403. And it really looked to how other states were able to better manage their Medicaid budget. So one of the things the state of North Carolina wanted to do is to really gain control of their Medicaid expenditures so it would be predictable, and they would know how much they would budget each year and have to spend each year. The system before transformation was a system with the exclusion of VIA Health, because we are a managed care organization, is that people, doctors, any kind of Medicaid provider, your primary care doctor, any of your doctors, they would bill Medicaid directly. So it was an unmanaged system. So House Bill 403 really looked to change that. It created it created a whole plan, which included integrated care. It's one of the most important components of Medicaid transformation. So it's really looking at integrating mental health, substance use, developmental disability services, physical health care, pharmacy needs, all in one plan. And it added a category called mild to moderate mental health and substance use. Behavioral health is sort of a combination of those two. So that it would come under the standard plans, which I will get to in a minute, versus what VIA Health will be. It established a pretty comprehensive case management and transition to care issue, which is really helpful for individuals. And it also established a tribal option so that individuals who are enrolled members are able to choose a tribal option program, and they will be able to deliver both enhanced services, which are higher level than basic benefit behavioral health services, and physical health care. So as I said, the main goals is really delivering whole person health, trying to transition care management to embed it into provider organizations. Currently, case management, we don't call it even, we've just started calling it case management. We have that as a MCO, is called an administrative function, and they work with people with developmental disabilities to help with their plans of care. But it will really be putting case management with the provider so that it's a comprehensive approach. Improving hopefully a member's experience so they get all of their Medicaid services from one health plan. And one of the most exciting things I think for our region is the waiver really looks at how to address healthcare needs in a different way, looking at like what they're called social determinants of health, transportation, vocational training, education, job training and development. So it's really looking at embedding some of those things, and we have that Healthy Opportunities pilot through the Dogwood Trust. So many of our agencies and organizations will really be working to be able to help those plan members access more. So in North Carolina, as of July 1st, it's been a transition period. There are 3 types of what we call prepaid health plans, and that's just a managed care. So that would be standard plans, and that would be, you have 4 standard plans in here in Jackson County, here in Western North Carolina, AmeriHealth, Caritas, Blue Cross Blue Shield, of course, United Healthcare, and WellCare of North Carolina. So those are the 4 managed care insurance companies who are still private that are working in North Carolina. Tailored plans, that is what Via Health will become. So Via Health will change its approach in the way that it delivers services, which I'll talk to you about in just a moment. And then I mentioned the tribal option for enrolled members. So when you talk about what does that mean? So I have the slide Jackson County by the numbers. Currently in this county, there are a little over 9,000 people who qualify for some level of Medicaid service in the county. About 8,100 of those will move from Via Health and will begin being managed by a standard plan, and 834 are anticipated to remain in the Via Health plan. So of the people we serve now, we're serving a significant lower part of the population. So just looking at some of the differences, I think, and I know you probably have heard a lot of this before, so I hope I'm not speaking too quickly. So both of the plans, both the standard plan and the tailored plans, and then as well as the tribal option, they're really looking at whole person care. So if you belong to the Via Health plan, we will manage your mental health, substance use, developmental disability services, but we will also work to manage and contract with physical health providers and health systems to manage a person's healthcare needs, their pharmacy needs. So it's really pulling together any Medicaid service into each of the plans. The standard plans, they will also be doing the same integrated whole person care. So the difference is really is if you look at a standard plan, many of the people who are going to the standard plan are already Medicaid beneficiaries. They have a lower level of behavioral health care needs, so they would remain with the standard plan. It would be people who have mild to moderate needs. Right now, Via Health manages outpatient services for people with Medicaid. So if you just need to go to counseling, if you need to go to a group session, if you have what's called a basic benefit, so a low level of need, we manage that. That will not be the case any longer. So one of these 4 health plans will be managing your behavioral health. It will not be within Via. So the tailored plans, we will be doing different is we really are going to be managing the serious and persistent mentally ill. So people who are high utilizers of crisis services or inpatient stay, people who need care above and beyond just basic benefit therapy outpatient services. They receive a lot of community-based services, things where teams go out and serve a member at their home, making sure that they have access to a clinician, they have access to a psychiatrist. So anything that's community-based or a higher level of care than just basic benefit outpatient will be managed by Via. We also will be managing everyone who is currently on what is called the Innovations Waiver. I know you've all heard of that in the past, and those are people who have intellectual and developmental disabilities who receive a Medicaid waiver. So there's a long list that you can see of some of the services. There's some services like crisis services that everyone will get, whether you're in a standard plan or whether you're in a tailored plan. And then the higher level of services will be what we will manage along with their healthcare needs. So it's a much smaller population when you take out some of those mild to moderate mental illness outpatient services, but we will be doing a lot more with the more intensive care. So the transition has already started. July 1st was the go live date. So anyone who is a Medicaid beneficiary and qualified to be in one of these plans received numerous letters, numerous outreach, postcards, phone calls opportunities to make a choice. People could choose which health plan they wanted to go with if they qualified for a standard plan. There is a 90-day period starting July 1st where someone can change their mind. All they have to do is pick up the phone and call. There is a organization that's called an enrollment broker where they will help people make decisions. But say I signed up for Blue Cross and then I find out that my favorite provider is no longer in their network or can't serve them, so I can call and make that change. After the 90-day period, there will still be points of time where people can change either for due cause, such as I don't go to that provider anymore, I need to have a specialized service. So people can make choices, just like with our private insurance, there are times when you go through open enrollment, that will be happening with the Medicaid plan. So I'm not certain how much you've heard in the community, if there's been any notice. A great many people were auto-enrolled, meaning that they did not make a choice. So there was a list of folks where that primary number, their primary care physician was noted, and they would sign them up with the provider that they.
So what percent does that?
Pardon?
What percent
Auto-enroll. I'm trying to think of the numbers. I would say only about 20% of the people made a choice. The vast majority of people were auto-enrolled, meaning that they never made a choice on a plan, and the state, through an algorithm, either chose their plan based on their primary care provider and whose network they might be in, or it was an algorithm that would put them into a plan to have
so
some
it's
equity.
20 or 80% auto enrolled?
80, about 80. And I'll verify that number, but it was a very high number.
I could believe that, because you start going through all that with a person. And you start going through all that with a person, and it's kind of intimidating, or it is to a lot of folks.
Yeah,
When they start looking at all these options,
yeah.
they decide they want to go out and jump off a bridge or something instead of that.
Well, although the one great thing about the standard plans and the insurance companies, they had, obviously they all have to offer all the basic Medicaid services. I mean, all the services are the same, but each of the plans could give what they call perks, so some of them gave like, help with tuition, free cell phones, free minutes, there's a variety. Each of the health plans were competing.
Yeah.
And so they had a lot of things that people could, pick and choose from to say, oh, I would really like to have that incentive to enroll with that plan. So.
With the 9,000 that you mentioned were eligible for Medicare.
Medicaid.
I'm sorry, Medicaid. Is that that's all the citizens of Jackson County, no matter what age?
Right. Yeah, could be, some people can be Medicaid, Medicare.
Sure.
Right,
Sure.
and so, yes, yeah. We'll help if you need it.
No, I guess, Ms. Foreman, I was surprised. I thought it would be more than that, but.
Well, part of the issue, and I, because I'm speaking more from behavioral health.
Yes.
This
is just behavioral health.
No, it's overall, but I'm saying
okay.
That for behavioral health, it's Medicaid is not an easy program to become a member of. It's
Yes,
not
that's
income-based, it's based on the level of your disability.
Yes.
Are you seriously and persistently mentally ill? Many people who have substance use diagnoses don't qualify for Medicaid based on that diagnosis. Even people with intellectual and developmental disabilities, on the Innovations Waiver, which is a wonderful Medicaid program, it's based on slots that are allocated to each county, each MCO, not anybody who needs it. So if slots are filled, you go on what's called the Registry of Unmet Needs, and you may qualify for the Innovations Waiver, but it may take many years before you're able to get on it. And then state funds have to be used to pay for any supports you get.
And I'll just also add here, and when we get down way later on in our agenda, under other business, one of the things that I will do is hand out to each of you a piece of information to take with you and review. And this is from Carolina, Care for Carolina, talking about the expansion of Medicaid
Okay,
and the need for the expansion of Medicaid. I know it's in the governor's proposed budget. It was not included in the House. But I know we are going to have a presentation about this at our next meeting.
Oh, I'll
From
watch.
Casey Cooper, who will be here from the tribal, and also from Steve Heatherly from Harris.
Yeah.
So there'll be quite a bit of discussion at our next
Okay.
meeting where we'll discuss this, which talks about the expansion of Medicaid,
Right.
which is,
And I know that, that issue has sort of landed on the political spectrum, except for out west. We have many counties who are saying we have citizens who cannot qualify for Medicaid and cannot get services because the General Assembly, and I know I don't have much time, but I know the next time I come to present to all of you, and we'll be talking about it tomorrow, I did include just some financial information in your packet, because if you have Medicaid, it's an entitlement program. You can get services that you need. I mean, there may be gaps somewhere in the provider network, but if you do not have Medicaid and don't have insurance, the General Assembly has cut those funds dramatically, over 50 some million dollars over the last, 6 to 8 years, and that continues. So you have less money to serve more people. So, it's sort of a dollar and cents. How do you want to support the health of your community? I mean, I know that, people may have different opinion, but for the health of your community, the more people that can be served by Medicaid, the more they'll be able to access to help them maintain their wellness and maintain their recovery. That's for sure. Just quickly, thinking about transformation, I do want you to know, because it has been a very challenging, there was a huge lead up to transformation, and then the budget impasse and then COVID hit. So it started again, but even with a lot of discussion, I'm not sure how many people really understood what was happening.
sure.
Didn't maybe pay attention. So we tried to, there's a safety network built in. So if we have served somebody from VIA, and that person is mild to moderate, they will be transferred to a standard plan. Our care managers are staffing, they meet 4 days a week, Monday through Thursday, once with each health plan, to talk about needs of members, especially those who maybe have had crisis care or have had a higher level of service in the past. So it's a warm transfer, and that's been really great. There are also processes for people to transition back and forth between. So if I'm very stable at this point, but I have a crisis and I begin to need a higher level of care, then I will be able to receive that. So our systems are communicating and trying to help make sure that people are in the plan they need to be, and that the people transitioning from our plan to the standard plans, they have the knowledge and the case, medical information, the things they need to help them be successful. So there's just a lot of work going on there. So tailored plan, I hope to come to you today to tell you that BioHealth had been awarded the tailored plan. The standard plans went live July 1st. Which was the plan, tailored plans, what BioHealth will become. We submitted our request for proposals. You talked about a big doc. If you want to read a really big document, you can read our 2,600 and some page RFA response for the tailored plan. And so that was submitted. We hope that we will become a tailored plan. We have faith that we will. We have some of the best data and performance data across the state. But we don't know. It was supposed to be announced at several weeks ago. That announcement didn't come. It's being delayed. So hopefully in a couple of weeks, I will be able to let you know that we have the tailored plan award and that we will be moving forward with that. So that's a little bit of what I wanted to discuss today, and I won't take up more of your time. I did want you to, I sent you a handout on some of the budget information. I will let you know that we've been very successful in getting out some of our CARES Act funding. Over $26 million has been allocated, and we've spent our money. It's gone out for a variety of things to help the community. through telehealth, through getting people smartphones, to enhancing rates for our providers. So doing more state-funded slots with some of the funding we got through that. So, and then your dashboard, that's just a quarterly dashboard I sent out with some of the numbers of how many people we've served for the quarter. So that was a lot of information, but you're probably going to be hearing more and more about the health plans and managed care and how that's going. So if you do have any concerns or hear of any concerns for people, please feel free to give me a call. I can provide you that PowerPoint has information on the enrollment broker where people can call and get help.
And looking at what, and you, so Shelley, you did a great job at summarizing in a very short amount of time, a major undertaking by the state.
Yeah.
To go through this Medicaid transformation effort. And one of the things I hope that this will do, going back to this concept of a stigma, as we talked about with sidewalks, mental health. If there's ever been an issue that has a stigma, it's mental health. And, you know, people, I don't know what the problem is, why people can't think that the brain is an organ just like your heart or your liver or lungs or your arm or any other part of your body. You get sick, you go to the doctor, but we've always tried to separate those, and, you know, integrating this into one plan where it helps, I think, to address this. And I'm hoping that in the future we'll see a whole person. That's right.
Right. I hope so too. And the other thing I would hope, and you mentioned it with Medicaid expansion, as you know, for people with substance use disorders not being able to, if they can't access Medicaid, well, there are, you know, all kinds of treatments that include, you know, doctors and, you know, medications and things like that. Maybe some of that stigma will wear off, and people will say, yeah, they do need treatment. And it's more cost effective to let people have Medicaid and get treated than have to be, you know, constantly worried about how much money with state funds are we get. If you look, this pie is a great one, and the proportion will still be the same. You know, almost 80% of our budget is Medicaid. You know, a very small portion of our budget is from, you know, other funding sources, both through the General Assembly, counties, grants, that type of thing. So
Shelley, let's expand on it a little bit. Commissioner Strickland had brought up in this board, these board members have previously discussed the opioid crisis.
right.
And so really, let's just sort of bring this around, sort of wrap around to these discussions. You started touching on it a little bit about access to services sometimes is dictated by the ability to pay. Is that a correct statement? I mean, somewhat what you're touching on. So just for the board's information, briefly, just talk about VIA's role in substance abuse in general, then obviously how it relates to opioid crisis, but
right.
And then wrap it back around a little bit to the funding.
Okay, so obviously VIA Health, our staff, our care managers, ourselves, we're involved in a variety of community projects and community collaboratives dealing with many of them substance use. Many health departments across our region have like a substance use task force, and we participate in that. When it comes to our role, is we contract with a variety of providers. One of the ways that VIA has been as successful as it has in using the state dollars and serving as many people as possible with no insurance is we have a comprehensive care model. So in Jackson County, Meridian Behavioral Health is a comprehensive provider, and we give them all of the state funding for behavioral health and say, you have to have a walk-in center. People have to have access to outpatient services, group services. They're funded for a certain number of people to have a higher level of community-based services. Basically, we say you take all comers. They have medication-assisted treatment that is funded through state dollars. So having that comprehensive model gives us a place for people to go for treatment. The difference between indigent and Medicaid is that they may not be able to get a higher level of service, or they may have to wait to get a service that they needed that is more than an outpatient service. Medication-assisted treatment is it's the gold standard for treatment of people with opioid use disorders. We work with a variety of providers to be able to offer medication-assisted treatment. We have some additional funding outside of just our general allocation, where we contract with a variety of folks who do that. Dr. Holmes, he's not here in Jackson, but he serves people in Jackson. So we're working very hard and then developing relationships with FQHCs. Like Blue Ridge or Appalachian Mountain Community Health. They actually have a clinic here at the Meridian building over on Bonnie Lane by COG. So what is our role? I mean, one is we work to try to make sure what services are available and can be available, looking at opportunities to expand those, working with communities. I mean, I would be happy to help support any group here that wants to look at it. One of the issues with substance use disorders is readiness, pre-contemplated, like I'm okay, I can handle my issue, to, okay, I'm really ready to get support. In other communities, we have a lot of peer support specialists who are doing outreach and trying to link people to care. They're doing harm reduction work, and we've supported many of those efforts. So really looking at what is it in addition to services that help people recover or even want to begin treatment. And then once they begin treatment, how do they maintain the recovery? In several counties, they have programs in the detention center. Where if someone becomes incarcerated, you know, they can begin treatment. Some of them, even Haywood County has a medication-assisted treatment program for people coming in who are already on medication-assisted treatment. We're working to do some diversion programs. So we're open to working with the community to develop solutions. Across 22 counties, we have lots of great ideas. So we'd be happy to convene a group, you know, to say, what is it you would look, what is it that we need to do different? Because we know it's a huge challenge to get people to treat. I mean, even if we have to have people want treatment and be able to have the tools to support their recovery once they go through treatment. So we're happy to work with you, with any group that would be interested. Jackson is one of the counties, most of the counties have through the health department. It's totally based on the community health assessment that's done every 3 years. Many counties have like a task force around mental health and substance use issues. And they convene those groups and we participate with those. So, you know.
So I'm gonna write this back around to this pie chart. So I'm gonna simplify your world. I know your world's not simplified, but just, it helps me understand it.
Go for it.
You know, basically, they're the administration of the majority of the funds that's provided to our mental health and substance abuse providers, i.e. Meridian.
Yeah.
So when we deal with whatever, we're talking about Medicaid expansion, the state funds, so forth, VIA really worked with providers such as Meridian and the county and so forth to try to specifically work on substance abuse issues in our county. So when we start talking about access to revenues, i.e. Medicaid expansion, i.e. state funds, i.e., you know, it doesn't have to just be a conversation about Medicaid expansion. It could be any federal dollars. I mean, if you're talking about if we have settlement from this opioid lawsuit,
right.
Those are types of things that can be specific to go to our providers. And so ultimately, at the end of the day, if I heard you correctly, depending upon the payer source really dictates the amount or level sometimes of services that can be offered to the individual citizen. And so we don't have to go, you know, completely deep into this conversation, but I just want you to sit in this pie chart because this pie chart dramatically affects
It says it all.
this whole conversation that we're saying about how does funds flow through to our service providers who provide substance abuse treatment. And how we get,
And there's a great graph in there too, and I know I'm taking too much time, that looks at, it's this pie chart, and this was from last year, that one, right, or no, I'm sorry, the one there. I mean, it's such a visual. So in our catchment area, you look at how many people is called prevalence, like how many people would you expect would need services that are Medicaid, and then those who are underinsured. And then the amount of money that is attached to that, and you can see it's dramatically different in the funding between Medicaid and not Medicaid and no insurance. So, I mean, I don't know how you can get better than that visual and just the difference. So yes, we're happy to work with you, work with the community, and hopefully, work to increase our funding. In your quarterly report on page 2, you can see where people go for services. In Jackson County, the vast majority of people are using Meridian, but they also use Appalachian Community Health Services, which provides services. The Clyde Treatment Center is a MAP program, and you can look at the list of places where people go for services in Jackson County.
Other questions or comments?
What's the best way to contact you?
My cell phone, it's 828-508-9672.
Thank you.
Just one last question, and maybe I should address this to Chairman Mahan, but as you are aware, Ronnie Beal from Macon County Commissioner, he has been in negotiations with Mission to get the old Angel Hospital. They're building a new unit and for $1. And then the old hospital would serve as a regional in-person treatment center. Would that be through BioHealth money, or is that some other funds?
Joe.
Okay, well, so obviously there are a lot of moving parts on that.
Okay.
And there are people at the state level and at the community county level that are trying to think about how could a facility like that be utilized.
Right.
And so we would, we certainly are having a part of that conversation as far as what would it look like, but it would very much be based on that integrated care model,
Okay.
having accessibility for people, but and as we know more, because it's so it's
Yes, I
still
know,
in
it's
the
still-
quiet phase.
Right.
We will certainly bring that back if we
Good.
hear more, if that moves forward.
Well, I feel, and I know we all realize the closest inpatient is Morganton, isn't it?
Actually, Haywood Regional.
Yeah.
Haywood
Oh, do they
Regional
have
has
in-person? Okay.
an inpatient unit.
Yeah.
Mhm. And the Boston
But-
Center for Hope and Recovery has one level below inpatient. It's called a facility-based crisis.
Okay.
It's 16 beds for people with mental health and substance use disorders. And then Haywood County has an inpatient unit, which is heavily utilized.
Okay. How many beds is that? Do you happen to know in Hayward?
It is, I'll have to look.
That's
The
okay.
inpatient unit, and I just presented on that last week.
Yeah.
It's, it would have to be 16 bed, around the 16 bed as well because of the licensure, but I'll send you that
Okay.
information.
No, that's okay. I just,
Other questions or comments?
Thank
Shelley.
you so much. Thank you. Now that's a lot. Thank you.
thank you.
Thank you, Don.
Thank you. Ready for the next?
Yes, sir. Go right ahead.
So, next item we have is the proposed food contract. We do have here today Eddie Wells. Eddie is obviously our Director on Aging Services, and we do have Captain McCoy back there. This is the food service contract being proposed for both our aging meals and for our inmates. And we also have Matt Eubanks, who is the Vice President of Skillet, sitting here. And so we're all here available for you for any questions that may come up. This is something that's been discussed with the board previously. And so what is in front of the board for eventual final action in the next meeting or so is you do have enclosed in your packets the proposed contract. And I won't obviously go over the details of the proposed food service contract. We went over some of those issues at our last meeting. Just some key notes here. This contract here is for 3 years in itself. If you look at the pricing Going to the next page, the contract will include a clause in there to negotiate CPI on an annual basis. And then ultimately, we do have a termination clause in here if we're not, there's ways to terminate if we're not happy with the service being provided and things of that nature. I do want to point out the rest of this. It's important as far as the contract language, but it gets into legal issues, insurance issues, things of that nature. Please read it. It's been reviewed by our attorney. I will go back and look at the other attachments that you have here. If you go to attachment 3B, attachment 3B is the pricing. Now, if you recall, when the proposals were submitted for review by the board, there was one price. And that price was actually based upon the number of meals. So for example, under the jail itself, I'm trying to remember which one that was. Which one was that, Matt? I'm trying to figure out.
I believe it was the 50, which would be the third line down.
The third line down, yeah, right there, the 5.8.
582.
Yeah, so that was actually what was in the bid itself. But we'd asked, and we were working with Skillet, we wanted to see if we could get a sliding scale. So if we do purchase more meals, obviously the meal costs come down. The sliding scale backwards is not, it's not a negative for us, because the reality is our previous contract, we were required to buy a minimum set of meals. So we will always buy that minimum set there. So it really is a benefit to us to have a sliding scale for the meals to be cheaper if we purchase more. And then also we come back and ask them to look at agings. This is something Eddie had asked for, and they offered a sliding scale for aging meals also. So we feel like that's going to benefit to us and obviously a benefit to our operations. The final attachment is, or not the final attachment, the next attachment is the request for proposals. This is something that was presented to the board before, and this really is the detail of services that are going to be provided to us. As you recall, this is something that aging services and the jail and myself have worked on as far as trying to detail the needs of all of both agencies. And then the final item is 3D. And that, just so you know, part of the contract is we do maintain the equipment within the kitchen itself. So we've never had it formalized to this extent. So this really is something that I had Chad Parker, our Public Works Director, go back and really create a list. And this is the equipment that we're agreeing to maintain and or replace through the life of the contract for the contractor themselves. And so I would, Mr. Chairman, if it's okay with you, just recognize Mr. Eubanks and give him a little time if you'd like to say anything to the board.
Mr. Eubanks, welcome.
Thank you all very much for having me here today. We've been working with Don and the team over at the jail and at the Department of Aging for several months through this process. We're happy to have made it this far. If y'all have any questions for me at this time or up until the time to vote, I'll be happy to answer them. I don't know if you've been given a complete background of our company. I know we're behind today, so I won't go into a lot, but we currently manage exactly 35 kitchens in 4 states, Kentucky, North and South Carolina, and Georgia. In this immediate area, we do the counties to the west of Cherokee, Clay, Swain, and Macon. Just south of here, we service Raven, Habersham, and Stevens. And a little bit further to the east, we do McDowell County, Lincoln County, Cleveland, and Gaston. So we have a large presence in this area with our food service operation. Overall, our company feeds about 9,000 inmates, which adds up to about 175,000 meals a week. So, and we are, we're very well qualified in this area because we have so much around here. Our district manager actually lives in Hayesville. Our territory manager, Lee Farnsworth, lives in the general area as well. So we have a lot of backup support. And in the food service industry in the last year and a half, having a backup plan has been important.
Yeah.
So we're well qualified for backups.
Any questions?
I
Mr.
have-
Jones?
This might be for Mr. McCoy or Mr. Wells. What would be the high and low of the jail occupancy as well as the number of meals you'd serve with Meals on Wheels and the Council on Aging?
Yeah, sure. So right now, if you go back to that list there, we are at, about 190 right now. So that's at the 5.0860.
Okay.
So which is a good bit less than what we had when we went through the bid process. So, I mean, we feel pretty confident we would, definitely stay over where the bid was, but currently we expect things to grow from here because
Sure.
we just opened back up from a pandemic and get people back in the building, so it could even go to our numbers at this point.
So y'all also supply the Meals on Wheels?
Yes, we do.
With food for them to distribute?
Yes, we will.
Oh, okay, nice.
This would be for all the meals that we provide, which is our nutrition services. We have a senior center that's within the Department on Aging Concrete Nutrition Program. We also have one that's in Cashiers for the southern end, and then our adult day program, and then also our Meals on Wheels.
Gotcha.
And we also do those programs at Cherokee County and Clay County, out of our jails there.
Mr. McCoy, do you have a range of inmates?
Almost 200 meals a day, with 3 meal times, and maximum capacity 72 inmates, close to 300 meals that we're told we will.
Thank you. No.
Other questions or comments? Any other questions or comments from the board members? Mr. Adams, any follow-up?
So, Mr. Wells, you have anything you want to add?
That's just a question. Do you buy and use local food?
Our vendor is Performance Food Services based out of Oakwood, Georgia. And they do all of our buying and procuring for us and deliver our food to the facilities. We do have the ability to buy local produce. It's one of those things, you can't have a procurement director at every one of your facilities. So you have to have somebody that's a real spot on facility manager that has the ability to make sure that they're getting stuff that's USDA approved. It's like, you can't just go to a farmer's market and buy potatoes out of somebody's truck.
Right.
Because there's guidelines in the nutritional programs.
Right.
But we can get stuff locally if we can meet USDA requirements and we can make sure that we've got our documentation in order.
Well, we've got several producers in the county, a couple in particular, that they supply for Ingles.
Okay.
They have their own packing facilities.
Yeah.
Inspected by the state.
Good deal. Yeah, because
They meet everything at Ingles or any of these supermarkets.
Yes.
I don't know if that's meet your.
it will. And what it is when you're dealing with the Department of Aging, they get funding a lot of times through state and federal grants, and they have mountains of paperwork to go through, and you have to dot your I's and cross your T's, or that funding can get cut off. So I don't want to risk, picking up eggs from a local dairy guy when all of the paperwork's not in order. That's the thing, but it can be done.
A lot easier to go through a food service.
And because they handle all of that stuff.
Right.
They have people that sit at a desk and do it all day long.
Right.
But it is a possibility. I do it up in Swain County for Sheriff Cochran. We get sausage from a local manufacturer up there for his jail. So it is possible.
Any other questions? I think Commissioner Deeds and I want to make sure to know, can y'all make cornbread?
Absolutely. You make sure your pan's hot before you put the
You gotta
cornbread
have a
batter in.
skillet. You make that.
That's
That's right, the skillet.
You got a recipe? Got a lady here won't me.
I have a good recipe.
The
Thank you
little
very
blue
much.
box of Jiffy, one egg,
No.
half a cup of oil and butter.
That's what she's been using.
No.
All right, well, we thank you so much. And, do we want to go ahead and put this on the agenda for our next meeting? Or
Yes.
does the board want to take time to deliberate
Thank
it
you.
further?
Thank you.
I'm hearing a yes. Anybody object to that?
Thank you, Mr. Eubanks.
Okay.
Thank y'all.
And so just appreciate the board and just a reminder to the board, this contract as written becomes effective October 1st. We are talking about trying to work with our current vendor for transition. And all of that will be worked with our current vendor, and hopefully October 1st, we'll have a smooth transition.
Very Good.
So the existing vendor has said, yes, they will like show them the ropes and help them out and get them started.
Well, this is about helping the current vendor, not vice versa. They are well equipped to just come in and take over.
Take it over, yeah.
What we're attempting to do is a couple things, if you recall, I believe at our last meeting, we were able, is that they have stated to us they're willing to interview existing employees so that we can have the opportunity for them to transition. If you recall, these positions are going to be higher pay and actually will qualify for benefits too. But then also, if the current vendor is willing to work with Skillet, and as long as it meets their standards in regards to food, then there's potential for Skillet to come in and purchase inventory, because you have to really pay attention to this in the sense that we want to keep quality all the way up through the end of September, and then the next, you end on a Friday or Saturday, and the next Monday, you want to walk in with the same quality.
Right.
So the current vendor's willing to work with us and for us to work with them to help keep him whole, but also help with the smooth transition.
That's great, thank you.
All right. Next item?
Okay. Are we good, or do we need a break or anything?
Yep, let's take about a 5-minute break right quick. We'll give everybody a chance to get set up for the next one. Will we go into closed session for part of the presentation, or?
I think what we'll do is just before we'll ask Dr. Ayers to do the presentation. They have information that's online right now that goes over the bids and the numbers and a general idea of what we are talking about. Then the closed session, they do have specific information. So I would ask that if you have specific questions about the construction or whatnot, let's wait till we go into closed session, because this is security issues for the school. So there is a public presentation, and then there's a portion for closed session.
So, but the point being, we'll go into closed session and then come back out for the other remaining items.
Yes.
Under other business. Yes. Okay. All right, we'll be in recess for about 5 minutes.
I'm not sure if this thing's still rolling or not.
Excuse me.
You haven't heard our ice pack. Bless your heart. You want coffee or something? It's yours. I'll get you one. Water, anything?
Not
Show you something. It's something I've been working on about almost a year. It'll be a year, probably.
So big.
No, but it's something that helped our southern account and has something to do with. It's not a political thing. It was approached by a couple of people. One, bring it up, not knowing any history of it at all. And I made that commitment.
But
The horse trading, this is what we do.
Ready to go? Okay, we'll go ahead and come back to order. And we have our friends here from the school system. Don, do you have any opening comments?
No, sir, just, we have Dr. Dana Ayers here and Mr. Buchanan. This is in regards to the school safety projects that's been discussed for a couple of years now, and I'll just turn it over to Dr. Ayers.
Okay.
Mr. Buchanan, who's been living this for many, many years before I ever arrived.
So, Mr. Chair, members of the board, if you'll indulge me, I would just like to spend a couple of minutes talking about how we got here, particularly for the two newest members of the board to understand how we got to here. So in the spring of 2018, there was a school shooting in Parkland, Florida, that had ripple effects throughout our country, and it also impacted our kids in Jackson County. One of the ways that it was shown was in, you guys will remember, and many of us will never forget, we lived through 7 bomb threats over the course of about 2 months. And so, all of those bomb threats, all of them came down to children that were hurting, every single one of them. Many of our children in our community live in a world of chaos. And kids want to relate and want to be in a world just like everybody else. And so that was a way for many of them to turn their chaotic world into everybody else's chaotic world. And many of it's a cry for help. And so some of you heard me mention this before, but one of my proudest moments to be a resident of Jackson County, involved with Jackson County Public Schools, was when students from Blue Ridge Early College, Jackson County Early College, the community school, and Smoky Mountain High School organized amongst themselves and requested our presence. They said, we would like to speak to our school board and our county commissioners because there are things that we are expecting from our community to be safe. From that, there were 2 things that came out of that. One was that they needed more mental health support. Now, I find it fitting that you guys are speaking with representatives from VIA, and we work closely with VIA Meridian, which is now merging with Blue Ridge Health out of Henderson County. I will say, and this is Jake Buchanan saying this, not Jackson County Public Schools, the legislator in the state of North Carolina has absolutely failed the children in the state of North Carolina by not appropriately funding mental health support for our children. And that is a travesty, and it's borderline criminal. The thing that I'm so proud of is that the students said we needed this support, and our commissioners, in conjunction with the school board request, but our commissioners funded 6 additional school counselors. And make no mistake, the reason why the county commissioners and the taxpayers of Jackson County had to supply those positions is because the state of North Carolina does not fund appropriately student mental health in schools. And so very proud of you guys raised taxes in an election year, not a peep from the community. Everybody was in support of it because you heard me say a million times, the people of Jackson County love their public schools, they love their children, and it shows. And so that aspect of what the kids were asking for has been fulfilled. It's been highly successful. And we, you mentioned Commissioner Beal from over in Macon County. He called me up and asked me one time, he was like, we want to try and do something like this in Macon County. How'd y'all get it done? I said, we have a wonderful group of commissioners that funded it. So you guys just need to put your money where your mouth is and support the kids. So that being said, that component of it we feel very good about. We are utilizing our ESSERS funds, which is our COVID money, to support that program, expand that program, and do it in a way to extend those services. It's supposed to last for 3 years, but we're structuring it in a way that it'll be for the next 6 years. We'll have secure funding to make sure our kids have the mental health support that we need. That doesn't mean we're not going to keep going after grants, keep working with VIA and all those things, but we feel very good that we're doing better than most on supporting our students' mental health needs. The second part of that the kids were asking for was to eliminate situations like that happened in Parkland, and that having single entry points at all of our schools. And by single entry point, I mean that the traffic in and out of a school is funneled to one or two locations that are highly controlled, that are monitored, that are controlled, and secure. And so when most of our schools were built, the trend in the 60s and 70s and the 80s was actually to have kids going outside between classes. The idea was, when we go from this building to that building, let's get some fresh air. We live in a good climate. Let's get some fresh air, go from this building to the other, which makes for a nightmare when you're trying to secure it. You know, those of us that went to Fairview, Miss Woody worked at Fairview, the whole buildings were designed to go outside and walk around the pod to the next building. Smoky Mountain High School is a collection of buildings that we have started building in 1959 and just finished up the last one in 2013. And so they're all separated and not very much connection. Smoky Mountain Elementary School was probably in one of the better shapes in that most of the building was contained, but the commissioners funded in the late 90s to build a middle school building at Smoky Mountain Elementary. And then Blue Ridge, it is also a pod school for the elementary side, and then had a new high school wing built in the late 90s as well. So those schools, we were not able to secure them as single entry points. Scotts Creek, we have secured as a single entry point school. Cullowhee Valley, we've secured as a single entry point school. Jackson Community School, we've secured as a single entry point school. And we did all of those with local funds and our own working with contractors to make that happen in all those schools. We also, if you guys remember, I came before you years ago and said that I feel like we could save some money because these plans would encompass a lot of security cameras. So we came to the commissioners and we got about $250,000 to go ahead and install those security cameras ourselves, save probably 30, 40, 50% of what it would have cost to pay a contractor to do it. We did it ourselves over the course of about a year. Actually, I had an SRO yesterday talking to me about how more secure he feels like the school is just from the standpoint of having those security cameras. So what is left for us to have single entry points at all nine of our schools is to do some major construction. So the document that Dawn has provided for you is the cost. The plan for these, I can't stress enough how much collaboration there was. Todd Dillard was heavily involved with emergency management. The fire chiefs were involved from their districts and the school that was in it. And of course, the Sheriff's Department, Sheriff Hall was heavily involved. Shannon Queen and Avery Brown in particular were involved with a great deal number of meetings to help us work through this and come up with a solution. We can talk about it a little bit more in detail in closed session. We don't share the plans to explain how the facilities will work for security reasons, but we can share with you a little bit more in closed session how that works. But what you see here is the bid totals for the low bids for each 4 of those schools. We did bid the project out as 4 individual projects, hoping that there would be, there might be a company that would be interested in one that's in a certain part of the county that's close to their home base. And as it turned out, one company had the low bid for all 4 of the projects, and that was Buchanan and Sons. No relation. I did graduate from high school, Chris, but we are not the same set of Buchanans.
You mean there's more than one set of?
There are. I tell people that we're taking over, but then I remind them we were here 200 years ago, so we took over a long time ago.
Okay.
Yeah.
So that represents our low bids. I stood here before this board before when we initially had these conversations. We were hoping that this would be under $3 million. We had some estimator work that had put the project at somewhere between $4 and $5 million. And now once the bid, it's only real until the bids come in. We have with all contingencies, we're looking at $7.4 million to be able to secure all 4 of those campuses. I'd be happy to answer any questions that the board has about the process, how we got there, about any of the prices. The alternate 1 and 2 on here, alternate 1 is some planners And you'll see the stone walls when we go into closed session, but these are all stone walls that are appealing. We were adamant from the very beginning, these are schools, they are not prisons. We want them to feel like forts, but we don't want them to feel like prisons. And so we tried to make them as appealing as possible. And alternate one for Fairview and for Smoky Mountain High School was to include some planter walls in areas where kids normally sit outside and things like that. So some planter walls and some landscaping in that. And then alternate two that ended up being no cost was just our preference for the controls. When we're done with this, every single school will be swipe card entry. There'll be no brass keys, no metal keys getting into any building. There will be internally, but to get into the building, you have a swipe card. There's a camera there. So if you come in, your picture's taken, it tracks what time you were there. If we have an employee that is no longer with us, we can instantly deactivate their card. We can, we love hosting youth sports and everything else at our facilities. And so we can turn on a card for Rusty so that he can have the rec department out at Fairview's gym on Saturdays and Sunday afternoons, but then those kids don't have access at 2:00 in the afternoon on a school day. So it just really strengthens up our ability to control access to our kiddos.
Okay, if we could, just so that it's hard to see on the screen, but you do have 11 by 17, 14 by 17, thing that you can read the bid tabulation sheets. Just give a little history of the bids, because we bid it out once and then we received one, they bid it out once, we received one bid, we were not legally able to open, they were not legally able to open the one bid because you have to have 3 bids in during your first round. So the Board of Education had to go through a second bidding process in which you can see that under the bid tab sheet, you have Buchanan and Sons, who did submit a bid for all 4 projects and is actually the low bidder on all 4 projects. But there is H&M Constructors is the only other bid that was received, and H&M Constructors only submitted a bid for 2 of the projects. And basically they didn't want to drive out to the outlying areas of our community, Blue Ridge and Smoky. And so at this point, that is the history of the bidding process.
Absolutely.
Walk me through how a student would go into the building.
Can't do that, can we?
Let's do that. Oh, yeah, I'm sorry.
Yeah, well, but that for the most part, without getting into the details. So, but there will be, like for Smoky Mountain High School, for example, students that come into the school will need to come through the front door. There will be a breezeway, and this isn't really getting into too much because, every kid will walk through it, every parent that comes through, but there'll be a breezeway. And they'll only be coming through one way. So at the beginning of the day, when all the kids are coming in through, it'll be highly monitored. There'll be people there watching, making sure the people that are coming in are the folks that are supposed to be coming in. And then once the school day is started, those doors will be locked behind them. And the only way to get in is.
And that's good. I'm glad about that. Thank you.
Yeah.
Are there questions about the bidding process?
There was one caveat to the paper. I read it on the attachment we got, that there was something about a security system that y'all didn't approve.
So there was, not sure exactly, but there was a couple of alternates. We had preferences for the equipment that would work with the security system that we wanted to have.
That's what it was.
There's probably something in the bigger contracts because originally the architect wanted to design and install all of the cameras themselves.
I see.
And that's when I said, we could do this ourselves and save a fortune.
Sure.
And so that's probably in the original.
Okay, that answers that.
But but just as a point, this represents all of the measures that were recommended by the sheriff's department, by emergency management, and by the fire chief. So we did not, the only thing that we put in as an alternate was the appearance feature with the planners, but everything else represents what the emergency management and law enforcement in our community said, this is what we need to do to secure our schools.
And then the other component to add to that would be, after all those eyes looked at it, it also meets state building code
So that's the reason why I'm
Why it
standing
takes so
here.
long, yeah.
That's why because it's a good point. Nobody had ever done this before. Because most of the codes for schools have to do with fire. And so that's why the majority of these are a wall project, because we still have to meet the fire code to get the kids out of the building and far enough away from the building, but we need to keep them in a safe location inside the walls. And so it took a lot of hand-holding, a lot of trips down to Raleigh for both code enforcement at the state level, and also we have to send everything to North Carolina Department of Public Instruction to sign off on. And so there was a lot of back and forth for 18 months. I'd say a year and a half of this has been, how does this, but this is nobody has done this in the state of North Carolina. But I will say that there are a lot of other school districts that are looking at the exact same thing moving forward. Because all these schools built at the same time, they have the same challenges.
Has a lot of this been changed on the run?
No, sir. So
I mean, you got the information from the sheriff,
Todd Diller, Emergency Management.
right at Parkland, they gave you all this information.
Yeah, well, we had numerous meetings. So we got together and the architect came up with an initial, this is what we're thinking. We would meet with law enforcement. He would make the adjustments. They'd go back and redo the plans. We'd come back and meet again. We did some tabletop drill type scenarios where if this happened here, this is what would happen.
I'm asking is, Parkland, that's been 3 years.
Yes, sir.
I'm sure there's a lot happened. Well, I know there's a lot happened tragically between them.
So
But I'm sure there's a lot of things that people looked at and said, no, we was thinking 3 years ago, this is what we need to do, but we need to enhance that, or this is more important than that. That's why I'm asking you, has this been a thing that's been changing on the run?
So it has and it hasn't. So unfortunately, what I can say is from being involved with this for now 10 years, looking at this, is that we knew 10 years ago what needed to happen as far as procedure-wise, for the most part. Locked doors. There's only been one situation in the history of all the school shootings in the United States that students that were behind a closed locked door were ever wounded or killed in a school shooting. If you're behind a closed locked door, you're safe in a school. Only one time, and that's because somebody knocked on the door and they let them in. So those sorts of practices have been around and have been secure. Most of the changes we work closely with the sheriff to send all our SROs to either the state or the national conference every year to come back with best practices. And a lot of the things over the last 5 years have been things about identifying people who are at risk, identifying red flags and situations like that. So the facility end, I feel like, yeah, there's going to be some things, but there was a debate forever. And Miss Woody will remember this when we were teaching. There would be one time they would tell you keep your doors locked. The next time they'd tell you keep your doors unlocked. It'd go back and forth. It'd be a different thing every year. All of that is kind of normalized to where the best practices on the facility are kind of hammered down. The best practices that are always evolving are how you work with kids in crisis, and how do you work with a situation where you've got a red flag. Here's somebody that's in a state of mental distress and has access to weapons. How do you handle that situation? So understand your question, Coach. That's a great question. And we feel like that it's something that we can adapt to if we needed to.
Good.
But the best practices are there.
And I think I'll add to that, Commissioner Deeds, that, something that's somewhat similar is our health department facility. All of a sudden, when we were in the midst of all this remodel, we're near the final days, and then all of a sudden we have a pandemic. And it changed the face of how we do things. And it's a whole new aspect or component to it. And that's where we were able to do change orders and go in and do some modifications to adapt to the new threat that faced our people. And so I feel sure that as we continue to monitor and are aware of things that are happening across our nation from a school safety standpoint, and we realize or understand or see ways that we could enhance or improve, then we can go through the change order process.
Absolutely. But you're never going to get away from a single entry point and
Exactly.
securing a school's interest.
Mr. Buchanan, the 7,7,022,000 and 7.4, is that 400,000 the contingency for the 4 bids?
So that includes in the breakdown there, the contingency is actually in the allowances. So what we have learned through other projects that we've done, so we're required to have 2% contingency. I think other state agencies are required to have more. We have learned that the allowances on materials serves as the contingency. And so with that, we have over 6% of contingencies in there. But the other, the difference between the 7 and the 7.4 comes down to a little bit of testing that's left to do. And then the remainder of the architectural fees for the project. We've paid, the total amount was $519. We've paid $252 up to this point, so there's only $266 left. And then there's some other costs. One of the things that I will mention is that this turned into a large engineering project for the water guys, because we actually have to have a system to be able to get water for the fire department to be able to fight fires once they're inside. And so Victor Lofquist, which many of us know, did way more extensive work on this originally than we had thought. Smith and Paget has agreed to not charge us for all of the engineering work that's been done or will be done by Victor, because they do understand that the cost of this project has gone up over time. So what they had initially, when they invested their money in designing the plans, was at one cost, and now it's a lot more. So they have cut us a little bit of a break on the engineering costs.
That would be your FDCs, your fire department connection points for sprinkler support systems.
Yep, we're all codes are still in place for egress for students and for being able to fight fires inside those courtyard walls.
How would y'all like to proceed? You want to talk about funding sources, or you want to go in closed session and talk about details, answer any questions, then come back to funding?
Yeah, I think because ultimately there will be just choices for the board, and that's going to relate to the funding conversation. So I think it may be appropriate to go in closed session, see if there's any questions about the detail, then come back out.
Well, we do have, under general statutes, the authority to go into closed session for, we're going to do this under 3 different items. The 143, 318, 11A1, which is confidential information. 143, 318, 11A8, school violence response plan, and A9, which is anti-terrorism plans. So do I have a motion to go into closed session concerning these 3 items?
So moved.
Second.
All in favor say aye.
Aye.
We'll give them a chance to disable the cameras.
No.
Okay.
Just